Hi, I'm Dr. Lee. I'm one of the physician editors here at Epocrates. I'm going to give you a quick demo on the free Epocrates application available on the iPhone. As a family physician, I often saw patients who also were under the care of specialists. For instance, say I'd see a 72-year-old female patient for the first time. She gives a history that she'd been on medication for hypertension, started by a cardiologist years ago, but she can't remember the name. Luckily, however, she can tell me what the pill looks like. I can't tell you how many times this occurred when I was in practice. But now, with Epocrates and the wonderful graphics on the iPhone, life just got a lot easier. Let me show you. All I have to do is pull up the iPhone and call up Epocrates via one of the shortcut icons. Then I can go straight to the pill identifier, which allows me to enter the various characteristics of a drug that I do know, such as shape and color. Based on the patient's description, I select round and enter the code 222, which appears on one side of the pill. Then it's just a matter of letting Epocrates find me the best match, which in this case turns out to be hydrochlorothiazide. I can even go as far as showing my patient the picture of the pill to confirm it's the correct medication. Once she does that and agrees, the mystery is solved. However, it doesn't just stop there. I can then go on to click on the drug name hydrochlorothiazide and be taken directly to the monograph should I want to familiarize myself with the drug. Epocrates provides me invaluable information such as indications for use and available dosing. This information is developed in-house at Epocrates, and my team is always updating the content to keep it current for clinicians. Now say that I notice that the patient's blood pressure is still abnormally high despite the years of being on hydrochlorothiazide. I decide to add another medication, perhaps the beta blocker, to Norman. I know from my patient's chart that she recently enrolled in United Healthcare of California. So I go to the formularies and select United Healthcare of California, but I see that Tenormin is not a covered drug. I can, however, click here for alternative medications or even a generic option that may be covered. I see that atenolol is a generic medication that is covered by her insurance. Even for patients who may not have insurance, I can look up the retail drug price and give them a ballpark estimate of what their out-of-pocket costs might be and discuss other options if necessary. But wait, there's more. Before prescribing the new medication, I always want to check the other medications that the patient is taking. I want to make sure that the atenolol that I'm considering prescribing will not interact with her other medications and potentially be harmful to the patient. All I do is click on the drug interaction icon and enter her list of medications. She says that she's taking an aspirin every day, Clarinex for her allergies, and Celebrex for joint pain on an as-needed basis. Traditionally, I'd have to look up each medication and cross-reference the adverse reactions individually. Epocrates, however, allows me to check interactions for up to 30 drugs at one time in just a matter of seconds. With one touch, I can run the interaction check and see that there are two potential problems. In this case, I would just advise my patient to decrease or consider stopping the Celebrex altogether. Now I know it's safe to prescribe the new medication, and I know it's covered by her insurance. I can tell you personally, patients love it when their doctors use technology. It gives them the confidence that the physicians have the most up-to-date information right at their fingertips. And even better, it can all be done in the exam room with the iPhone. On top of it all, if you're on call and you need to call the hospital, you can call on the iPhone and answer all the questions that you need with Epocrates, all in one handy device.